Hello, dear students. Welcome to GDC. In today's video, we are going to discuss the pathophysiology of uh, rheumatoid arthritis in a flowchart form. And its drugs that is employed for rheumatoid arthritis with a simple mnemonics. Okay. So this flowchart I have prepared to simplify the pathophysiology of rheumatoid arthritis. Okay. If you will see, so rheumatoid arthritis basically this is an autoimmune disorder. Autoimmune disorder means this is a type of disease when our body not able to distinguish between self and non-self. So that is basically called as autoimmune disease. So autoimmune disease are basically this is basically rheumatoid arthritis basically occurs due to inflammation around your joint. So basically in inflammation, which immunoglobulin is participated? One question can be asked. Please remember IgM antibody. Okay, IgM immunoglobulin is one of the important factor for inducing rheumatoid arthritis. So you have to remember that. When there is inflammation in our joints, so there will be a release of FLS, fibroblast-like sinusoids. So when there is a inflammation in the joints, there is a release of a inflammatory molecule that is called as FLS, fibroblast-like synovitis. Fibroblast-like synovitis. So these fibroblast-like synovitis basically undergo proliferation. Proliferation means they will divide and proliferate, and they can also activate RANKL. What is RANKL? Receptor. Please write the full from RANKL start for receptor of activation for NF kappa B ligand. NF kappa B is your nuclear factor kappa B ligand. Okay, these RANKL basically causes osteoclast activation. So there are two type of bone cell. One is your osteoblast, one is your osteoclast. Osteoblast cells are responsible for the bone formation. They divide to synthesize or to strong the bone. Whereas osteoclast are basically causes bone erosion. That means they basically causes damage to our bone. And these type of cells basically activated by RAN, receptor of activation of NF kappa beta ligand. How this NF kappa RANKL will activated? It will activated by FLS, fibroblast like synovitis. So once this osteoclast will activated, it will causes bone damage. Okay, the joint damage is one of the important symptoms of prolonged chronic rheumatoid arthritis. So this FLS proliferation can also activate this macrophage. Macrophage will going to release these interleukins like interleukin 1, interleukin 6, and TNF alpha. Interleukin 1 will causes angiogenesis. Just now we have discussed that angiogenesis is basically a process where new blood synthesized. So when there is a new blood synthesized to the inflammatory site of the joint, so that leads to severe complication. Next, TNF alpha participate in extracellular involvement, extra-articular involvement. So there is a complication because this rheumatoid arthritis basically considered as a systemic inflammation. That means your system is involved. So due to this inflammatory markers that is generated over here can migrate it to the other organs like heart. So that's why rheumatic heart disease. Okay, other or inflammation to other organs can occur due to this systemic involvement. So this is basically due to the TNF alpha that is generated. Okay, so that's why they involve in extra articular involvement. Also, they participate in inflammation. Okay, so these are the things that basically the basic pathophysiology of this rheumatoid arthritis. There are some pre-rheumatic factors. There are some factors they can also predispose this rheumatoid arthritis condition. What are these factors? Factors like smoking, gingivitis. Okay, smoking, gingivitis, genetic and epigenetic modification. If you are having some type of genetic and epigenetic modification in your body. So that can also act as a predisposed factor for inducing this rheumatoid arthritis. So that basically activate your APC, that is your antigen presenting cells, and that activate ultimately T cells. T cell activate B cell. B cell is going to release your IgM antibody. Just now I have discussed the immunoglobulin IgM is act as a crucial factor for development of and this rheumatoid arthritis. That's why during rheumatoid arthritis, physician prescribe the test the detection of IgM antibody. If IgM antibodies is there in the blood, that means there is a chance that that patient is suffering from rheumatoid arthritis. Okay, so this IgM antibody will started depositing inside the synovial fluid and it induces inflammation. So basically, we call that inflammation is the most important factor during this rheumatoid arthritis, and this inflammation can affect the brain, your joints, in your uh, what we can call different joint of your body. It can also affect your head. Many things that can be affected with this joint. Severe pain is basically seen during this condition. So, to how do you will going to treat? So, you will going to treat by this anti-rheumatoid class of the drug. So, to remember this anti-rheumatoid class drug, you have to simply remember a mnemonic slice. Okay, slice. Okay, so there are two class of the drug. One is your DMARS, another one is your adjuvant. Okay, one is your DMAT, another one is your adjuvant. So adjuvant means so these are the additional drug like your prednisolone, your glucocorticoid. Okay, so adjuvant class of the drug is your prednisolone. Okay, so DMAT class of the drugs you can remember by there are two subclasses. One is your non-biological agent, another one is your biological drug. So non-biological drugs you can remember by simple mnemonic SLICE. Okay, so SLICE stands for S stands for sulfasalazine. Okay, L stands for leflunomide. I stands for immunosuppressant drugs like your methotrexate, azathioprine, cyclosporine, and E stands for hydroxychloroquine. Okay, so slice mnemonic. A stands for sulfasalazine. L stands for leflunomide. I stands for immunosuppressant drug. Immunosuppressant, we have three class. One is your methotrexate, cyclosporine, and your azathioprine, and chloroquine and hydroxychloroquine. Okay. Next is biological agents. So biological agents are these are the drugs. They are basically block these inflammatory mediators. You can see the inflammatory mediators that are generated over here. This inflammatory mediator that generated over here that basically blocked by your biological agent. Okay, that basically blocked by your biological agent. So which includes TNF alpha inhibitor. So TNF alpha inhibitor example is your adalimumab, entanercept and infliximab. These three are TNF alpha inhibitor, adalimumab, entanercept and infliximab, and interleukin 1 antagonist, that is anakinra. Okay, direct question asked from this part: which of the following is a DMARD? Which of the following is not a DMARD? Which of the following is a TNF alpha inhibitor? Which is not a TNF alpha inhibitor that is used in rheumatoid arthritis? Like that, you will get a question from this topic. Okay, so one question can be asked: which anti-cancer drug is used as a treatment for for rheumatoid arthritis? That is your methotrexate. This can also be one question. And chloroquine, hydroxychloroquine, these are basically your anti-malarial drug. Okay, so you have to remember this class. A simple mnemonic I have explained to you. This will help you to remember this class. Thank you. Thank you so much for attending this class. For more such content, follow our YouTube channel GDC Classes English. Stay connected with us. Thank you.